Hello, welcome again in our journey in the neck to reach the thyroid gland. In part 1, we have stopped at the sternocleidomastoid muscle. We have removed the skin, the platysma, the investing layer of deep cervical fascia. Then we stopped at the sternocleidomastoid muscle. As you see here, it has a sternal head and the clavicular head, and is inserted into the mastoid process as you've mentioned before. Okay, behind the sternocleidomastoid muscle, this is a group of muscles, long flat muscles, called the infrahyoid muscles. Why? They are called infrahyoid muscles because they lie below the hyoid bone. This is the hyoid bone, as you see here, and this is a group of muscles called infrahyoid muscles. They are all long and flat muscles. The first one here, as you see, just below the sternocleidomastoid muscle, is called omohyoid muscle. Omohyoid muscle, omo means scapula, hyoid means hyoid bone. So this is obvious that this muscle connects between the hyoid bone and the scapula. Okay, it has a superior belly and inferior belly, and in between this is intermediate tendon. Okay, superior belly, inferior belly, and intermediate tendon. This is called omohyoid muscle. This is the first muscle we will face just after we cut the sternocleidomastoid muscle. This is the omohyoid muscle, hyoid bone and scapula. Omo means scapula. Okay, the next muscle, just medial, just next to the omohyoid muscle, is called sternohyoid muscle. This is the sternohyoid muscle. The sternohyoid, sterno means sternum, of course, hyoid means hyoid bone. So this muscle is between the hyoid bone and the sternum, just medial to the omohyoid muscle, and it's of course one of the infrahyoid muscles. Now, in this picture here, as we see, the sternocleidomastoid muscle, and behind it, just behind it, the omohyoid muscle that lies between hyoid bone and the scapula behind, and just medial to the omohyoid muscle, we find the sternohyoid muscle, sternum and hyoid bone. Okay, again, this is the hyoid bone, sternocleidomastoid muscle, the omohyoid muscle. This is the superior belly of omohyoid muscle, and this is the inferior belly of omohyoid muscle. Okay, here in this photo we cannot see the intermediate tendon because it is lie behind the sternocleidomastoid muscle, but we can see the superior belly and the inferior belly. The intermediate tendon will just be here, just behind the sternocleidomastoid muscle. And here, just medial to the omohyoid muscle, we found the sternohyoid. So we have omohyoid, sternum, omohyoid, and sternohyoid. Okay. And this is, of course, the hyoid bone, and of course, this is the clavicle. Now, in this photo, we cut the sternocleidomastoid muscle. As we see here, it's cut. And we cut also the omohyoid muscle. This is the omohyoid muscle. Here, the superior belly is cut. This is the intermediate tendon, and this is the inferior belly of omohyoid. We cut the omohyoid muscle here so we can see what lies behind it. Okay, this is here the sternohyoid muscle. This is the sternohyoid muscle. Okay, this is the hyoid bone, and it's connected below to the sternum, of course. Now we see these muscles. Here we have the thyrohyoid muscle. The thyrohyoid muscle. So here, this portion is the remnant of the omohyoid muscle. As we cut the omohyoid here, so omohyoid must be like here, from here to here, but we cut it. So this what just lies behind the omohyoid muscle. we have the thyrohyoid muscle and the sternothyroid muscle. Okay, now there's a question. What is meant by thyro here? You hear me say thyroid. What is thyro? Do I mean thyroid gland or thyroid cartilage? I mean, of course, thyroid cartilage. This is here the thyroid cartilage, and this is here the cricoid cartilage, of course, and this is here the thyroid gland. So again, this is the hyoid bone, this is the thyroid cartilage, here we found the cricoid cartilage, here we found the thyroid gland. Now let's focus on the thyroid cartilage. We see here the thyrohyoid muscle. From its name, now we know that it's between the hyoid bone and thyroid cartilage. Okay, just under it, the thyroid cartilage gives attachment to another muscle called sternothyroid muscle. Sternothyroid muscle. So sterno means sternum, of course, and thyroid means thyroid cartilage. So these are the four muscles which are flat and long, so they are like strap. They are like strap because they are long and flat. They are called strap muscles or infrahyoid muscles. So as we see here we got the omohyoid muscle. This is the superior pelvic omohyoid muscle. This is the sternohyoid muscle. We cut it also so we can see perfect. This is perfect visualization of the thyroid cartilage, and above it gives attachment to the thyrohyoid muscle and below the sternothyroid muscle. So this photo is very good to visualize the strap muscles or the infrahyoid muscles. Okay, in this photo, of course, we cut the sternocleidomastoid muscle. It's here. Okay, this is the mastoid process, and this is the sternocleidomastoid muscle. It's cut here, and this is the remnant of it. So, and below it, there must be the omohyoid muscle, but we cut it also. And here, the sternohyoid muscle, but we cut it. So now we have the thyrohyoid muscle, and sternothyroid muscle. Let's recap what we have mentioned about the infrahyoid muscle. The infrahyoid muscles, they, from its name, of course, they lie below the hyoid bone. They are also called strap muscles because they are all long and flat, like a strap, like a belt. So they are all called the infrahyoid or strap muscles. There are four, of course: sternohyoid, sternothyroid, thyrohyoid, and omohyoid muscles. Excluding the sternothyroid, the infrahyoid muscles either originate or be inserted into the hyoid bone. So we can easily know this from their names. We have sternohyoid, so of course there is relation between it and the hyoid bone. And we have thyrohyoid, so the hyoid section is present in it also, and the omohyoid also has the hyoid section. The only exception is the sternothyroid, which is between the sternum and thyroid cartilage. Okay, it has no relation to the hyoid bone. Okay. All of the infrahyoid muscles are innervated by the ansa cervicalis. What is ansa cervicalis? We will talk more about it later on. Do not worry if you do not know about it before. The ansa cervicalis is derived from the cervical plexus, the cervical nerves number 1 and 2 and 3. C1, C2, C3, they are all gives branches to form something which is called ansa cervicalis. Ansa means handle because it looks like handle, so it's called ansa cervicalis. Cervicalis because it's derived from the cervical nerves C1, C2, C3. And we will talk more about it later on in the next few slides. Okay, this ansa cervicalis gives nerve supply to all the strap muscles except for the thyrohyoid muscle, which is innervated by fibers only from the first cervical spinal nerve traveling with the hypoglossal nerve. Okay, this is a little bit complicated, but we will understand this more and more in the next few slides. We have something which is called ansa cervicalis, derived from fibers from C1, C2, and C3. Okay, they supply all the strap muscles except for the thyrohyoid muscle. The thyrohyoid muscle is innervated by fibers through the hypoglossal nerve. Through the hypoglossal nerve. So not from the ansa cervicalis, but through the hypoglossal nerve, and we will see in the next few slides. Okay. This is a good photo showing the infrahyoid muscles isolated from all other content of the neck. We see here, of course, the omohyoid muscle. This is the superior belly, and this is the inferior belly, and this is the scapula. Okay, this is the intermediate tendon between the superior belly and inferior belly of omohyoid muscle. This is the sternohyoid muscle, of course. This is here. Here we have the thyroid cartilage. This is the thyroid cartilage. It gives attachment above to the thyrohyoid muscle and below to the sternothyroid muscle. Okay. And of course, this is the hyoid bone. So in this photo, we can see that all the strap muscles are related to the hyoid bone. We have thyrohyoid, we have omohyoid, we have sternohyoid. The only exception is the sternothyroid muscle, which is not related to the hyoid bone. Okay, what is ansa cervicalis, which gives nerve supply to the strap muscles? Ansa, as I mentioned before, means handle. Yes, this is the ansa cervicalis. Ansa means handle, so it looks like handle. This is handle and it looks like handle. This partition is called the ansa cervicalis. Ansa cervicalis is a loop just like this and is formed by muscular branches of cervical plexus formed by branches of cervical spinal nerve C1 and C2 and C3. We have here, this is C1, this is C2, this is C3. They all gives branches. Okay, as we see here, this is branch from C1, this is branch from C2, this is branch from C3. Together, they form what is called ansa cervicalis. Ansa cervicalis. The ansa cervicalis, as I mentioned before, gives nerve supply to the strap muscles. As we see here, it gives nerve supply to strap muscles, except the only exception is the thyrohyoid muscle, as you mentioned before, because it is supplied by a branch from C1, as you mentioned before, which travels through the hypoglossal nerve, and this is the hypoglossal nerve, as you see here. This is the hypoglossal nerve. So this is C1, C2, C3, and this is hypoglossal nerve C1 and 2, 3, all together. Form the ansa cervicalis. This is called superior root of ansa cervicalis. This is called superior root, and this is called inferior root. So superior root unite with the inferior root and form something which is like a loop, and it's called ansa cervicalis, that gives the nerve supply to strap muscles. Okay, where is the ansa cervicalis? Where we can find it in the neck? Okay, it is just anterior to the carotid sheath. It is embedded in the anterior wall of the carotid sheath. And what is carotid sheath? Carotid sheath, of course, as we mentioned in the first video, is one of the deep cervical fascia of the neck. So, the deep fascia of the neck, to recap, is formed of 4 layers. The first layer, the most superficial layer of them, is of course the investing layer of deep cervical fascia. We have mentioned before why it is called investing layer. So this is the investing layer of deep cervical fascia. It is the red thing just right here, the most superficial, which surrounds the neck like a color, okay? And we have here in the blue color, this is the pretracheal fascia. This is the pretracheal fascia. Of course, as we see here, it surrounds the thyroid gland. This is the thyroid gland, and this is the thyroid, and this is the thyroid gland. Of course, this is the trachea. This is the esophagus, of course, as we see here. And the green fascia, just right here on either side, is called the carotid sheath. Of course, this is the carotid sheath. And here, the vertebrae and vertebral muscles are surrounded by fascia called prevertebral fascia. So, to recap, we have investing layer of deep cervical fascia, which is the most superficial part. We have the carotid sheath on either side, which surrounds the vascular region of the neck. Why? Because it surrounds most medially the common carotid artery and laterally the internal jugular vein. Remember, in the first video, we called why it is called internal jugular, and what is the difference between internal and external jugular, and what is the function of internal jugular vein. This is the internal jugular, the most lateral compartment of the carotid sheath, and this is the common carotid. First, it's common carotid. Then, of course, as we all know, it splits into internal carotid and external carotid. The internal carotid will continue in the carotid sheath, while the external carotid lies outside the carotid sheath. So this is the common carotid, which then will become the internal carotid. Okay, and posterior to them is the vagus nerve. So this is the common carotid, internal jugular vein, and this is the vagus nerve. Okay, just behind the carotid sheath, we can find here the prevertebral fascia. Okay, the prevertebral fascia. And just anterior to the carotid sheath, we will find the ansa cervicalis, as we will see in the next few slides. Okay, this is the carotid sheath. Carotid sheath contain, as we mentioned before, the common carotid artery. The common carotid artery lies just medial. It occupies the medial compartment of the carotid sheath. And here we have, yes, it occupies the medial compartment of the carotid sheath. And here we have the internal jugular vein, and posterior to them we have the vagus nerve. We see here the common carotid splits into internal carotid artery, which will continue in the carotid sheath. That's why actually it's called internal, because it is internal in the carotid sheath, and the external carotid artery outside the carotid sheath. Here, a cross section. Just imagine I'm looking to the carotid sheath from above. This is the common carotid artery, most medial. This is the internal jugular vein, most lateral. Posterior to them, in between, this is the vagus nerve. Okay, just anterior. This is just anterior to the carotid sheath. We will find the ansa cervicalis, which actually embedded into the anterior wall of the carotid sheath. Yes, this is the ansa cervicalis. And this is the superior root, and this is the inferior root. And let's come back to a previous slide. The superior root, here the superior root lies just anterior to the common carotid. And here the inferior root just lies anterior to the internal jugular vein. So imagine this is here this is medial, and here this is lateral. The superior root lies medially, while the inferior root lies laterally. The superior root will of course be in front of the medial compartment of the carotid sheath, which is of course the common carotid artery, and the inferior root will of course lies anterior to the lateral compartment of the carotid sheath, which of course the internal jugular vein. So here the superior root, here the inferior root, and below they will make a loop which is called the ansa cervicalis. Okay, but what is the posterior relation of the carotid sheath? The posterior relation is the sympathetic chain, the cervical sympathetic chain. We'll talk more about it later on. Posterior to it, the cervical sympathetic chain, and behind it, of course, is the prevertebral fascia. As you mentioned here, this is the prevertebral fascia. This is the carotid sheath. In between, there will be the sympathetic chain. Okay. Now, this is a better visualization of the ansa cervicalis and the carotid sheath. We removed the carotid sheath here. So, here there must be the carotid sheath surrounding these structures, but we removed it here for better visualization of the content. Yes, this is the common carotid artery. Of course, as we see here, this is the internal jugular vein, of course, and this is the ansa cervicalis. This is the ansa cervicalis, as we see it derived from C1, C2, C3, and here is the ansa cervicalis. This is, of course, the superior root which lies medially. This is the inferior root which lies laterally, and they together form the ansa cervicalis. And as you see here, the branches go into the strap muscles. Here the superior belly of omohyoid, here to the inferior belly of omohyoid, here to the sternohyoid muscle, here to sternothyroid muscle, and this the thyrohyoid muscle, of course, as we see here. The thyrohyoid muscle here takes its nervous supply not from the ansa cervicalis. The ansa cervicalis, as we see here, this is the branches of the ansa cervicalis: omohyoid, sternohyoid, sternothyroid, but the thyrohyoid muscle takes its nerve supply from a branch, from C1. The C1 gives the branch to descend in the hypoglossal nerve. This is the hypoglossal nerve. Of course, this is the hypoglossal nerve, and it took a branch from C1 to deliver it to the thyrohyoid muscle. And finally, let's recap, and here we go. This is the platysma muscle. This is the platysma muscle. And behind the platysma, we will find the investing layer of deep cervical fascia, which covers the trapezius muscle and the sternocleidomastoid muscle, and it surrounds the neck like a collar, but we removed it here so we can like deal with muscles only, because the fascia, we have talked much about the fascia. This is the platysma, and this is the sternocleidomastoid muscle. Here we removed the platysma. Now we found the sternocleidomastoid muscles clearly, of course, and below it we can see the infrahyoid muscle or strap muscles, because this is the hyoid bone, and as we see here, this is the superior belly of omohyoid, this is the inferior belly of omohyoid, and in between, this is the intermediate tendon. As we see here, it continues, but below we cannot see it because of course it lies below the sternocleidomastoid muscle. This is the, as you see here, the sternohyoid muscle. The sternohyoid muscle, just medial to the omohyoid, we found sternohyoid muscle, and below them, this is the sternothyroid muscle. This is the sternothyroid muscle. Here, yes, this is the sternothyroid muscle. Okay, the thyrohyoid we cannot see here in this diagram, but we will see it in the next few slides with a better visualization. Now we removed the sternocleidomastoid muscle. As we see here, this is the remnant of it. It's cut. This is the omohyoid muscle. Now we can see it clearly, the superior belly, the inferior belly, and the intermediate tendon. This is the sternohyoid muscle, and this is the sternothyroid muscle as we see here. And now finally we removed all the strap muscles, and now we can see obviously the thyroid gland. As I told you before, My aim is that in the surgical anatomy we have to reach the organ from outside to inside. We removed all layers we can face until we found the thyroid gland. This is the thyroid gland here, and this is a better photo demonstrating the sternocleidomastoid muscle, of course, and this is the sternohyoid muscle, but we cut it. Okay, why we cut it? So we can see the thyrohyoid muscle. This is the thyrohyoid muscle. Here we can see. And this is the sternohyoid muscle, but we cut it here. And as we see here, this is the remnant of the sternothyroid muscle, but we removed it here so we can see the thyroid gland finally. We also removed the omohyoid muscle. So we removed the sternocleidomastoid and the omohyoid and the sternohyoid, and this is the sternothyroid. This is the remnant of it, because as we said before, the thyroid cartilage gives attachment above to the thyrohyoid muscle and below to the sternothyroid muscle. And this concludes our talk about the infrahyoid muscles. Thank you for watching. I hope you enjoyed the video.